Welcome! This is a video project authored by nursing students from Hunter College. The authors are Ada Acevedo, Belén Baigorria, Marvela Francis, Victoria Mayerov, Diesha Moore, and Giselle Osorio. Promoting health, sexual health, and preventing STDs among adolescents and young adults in community settings. The World Health Organization defines sexual health as a state of physical, mental, and social well-being in relation to sexuality. It requires a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. Adolescents, young people between the ages of 10 and 19 years, are often thought of as a healthy group. The CDC estimates that youth ages 15 to 24 make up just over 1/4 of the sexually active population, but account for half of the 20 million new sexually transmitted infections that occur in the United States each year. Many adolescents die prematurely due to accidents, suicide, violence, pregnancy-related complications, and other illnesses that are either preventable or treatable. Many more suffer from chronic ill health and disability. In addition, many serious diseases in adulthood have their roots in adolescence. For example, tobacco use, sexually transmitted infections including HIV, poor eating and exercise habits lead to illness or premature death later in life. While STDs affect individuals of all ages, backgrounds, religion, and socioeconomic status, STDs can take a toll on young people. For almost a decade, the federal government has invested more than $1.5 billion in abstinence-only programs which has proven ineffective in the long run. Programs which met a strictly abstinence-only definition were the only type of sex education eligible for federal funding, and no funding existed for comprehensive sex education. Researchers studied the National Survey of Family Growth to determine the impact of sexuality education on youth sexual risk-taking for young people, ages 15 to 19, and found that teens who received comprehensive sex education were 50% less likely to experience pregnancy than those who received abstinence-only education. Evaluations of comprehensive sex education programs show that these programs can help youth delay onset of sexual activity, reduce the frequency of sexual activity, reduce the number of sexual partners, and increase condom and contraceptive use. Researcher Douglas Kirby for the National Campaign to End Teen and Unplanned Pregnancy examined studies of prevention programs which had a strong experimental design and used appropriate analysis. 2/3 of the 48 comprehensive sex education programs studied had positive outcomes. 30% reduced the frequency of sex, including a return to abstinence, and 60% reduced unprotected sex. The Advocates for Youth also reviewed existing programs to compile a list of programs that had been proven effective by rigorous evaluation. 26 effective programs were identified, 23 of which included comprehensive sex education as at least one component of the program. Comprehensive sexual health education is taught in most public schools throughout the United States. Disseminating information in the school system affords the opportunity to reach the largest segment of the adolescent population. Sexual health should be taught by trained teachers and should be treated as a normal part of human development. Information on puberty and reproduction, abstinence, contraception and condoms, relationships, sexual violence prevention, body image, gender identity, and sexual orientation should be included. Information should be clear and factual and should be irrespective of young people. At the clinical level, sexual education is disseminated by healthcare providers. They are in a position to educate young people individually on sexual behaviors, reproductive health, contraception, health screenings, and any additional sexual health-related issues. At the research level, information is disseminated through national and internal health journals and research agencies, one of which is the Agency for Healthcare Research and Quality. Information disseminated by these entities are evidence-based and proven effective. At the policy level, sexual health information is disseminated via the U.S. Department of Health and Human Services as governed by Congress. Other agencies, such as the Center for Disease Control and the World Health Organization, are also involved with dissemination of sexual health information at the policy level. Information is often incorporated in clinical guidelines and is used by healthcare in clinical or social practices. An interdisciplinary team for the care of sexual health should consist of a healthcare provider such as an MD, an MP, a PI, or an RN, a psychologist and social worker, community health workers, and school board members. Why is this topic important to healthcare professionals? STDs are easily preventable, but are still a big public health issue in the US, especially among teens and young adults. It is important to prevent the transmission of these diseases because they do not only affect the reproductive organs but can cause complications in other bodily systems as well, which include infertility, fetal and perinatal health problems, cancer, and transmission of HIV. According to the CDC, there are 20 million new cases of STD infections every year. Half of these infections are among the 15 to 24-year-old age group. Many of these infections have no symptoms, and as such, this number of new cases may be underreported. Usually, when a person has an infection, they may have a fever. If they have an infected wound, there may be redness or drainage from the wound. This may not happen with an STD because they're symptomatic. And because of this, they go untreated and continue to spread the disease because they're unaware that they are infected. Differences in the male and female anatomy lead women to get more STDs infections than males. Female genitalia have more surface area, which equals more opportunity for organisms to infect women. This causes women to get infected more frequently and more seriously than men. Serious complications for women include pelvic inflammatory disease, ectopic pregnancy, and infertility. Having access to healthcare is a major factor in preventing and treating STDs. High-risk groups are the disadvantaged, which also is the same group of people that have the least access to treatment. What are the gaps in knowledge? Here are some myths. Only trashy people get STDs. If your partner has an STD, you'll see it. You can avoid STDs by having oral or anal sex. Once you've had an STD, there's no chance of getting it again. And if you get checked out and you're STD-free, your partner doesn't need to get checked as well. Fact number 1, STDs don't discriminate. Fact number 2, there's often no sign that a person has an STD. Fact number 3, where there's oral, anal, vaginal, or even just sexual contact, there can be STDs. The viruses or bacteria that cause STDs can enter the body through tiny cuts or tears in the mouth and anus, as well as the genitals. Some STDs, like herpes or genital warts, can spread just through skin-to-skin contact with an infected area or sore. Fact number 4, you can get some STDs more than just once. There is no immunity for STDs. One may get infected again if he or she has sexual contact with someone who has them. In fact 5, your partner could have an STD and not know it. The only way to completely avoid the transmission of STDs is through abstinence. Therefore, it is important for nurses to be able to educate their patients about the effects of STDs on the body, the best ways to prevent transmission of these diseases, the importance of getting tested, and how to be treated. The only way to know with certainty that one is not infected is through a blood test. Once a person is sexually active, it is recommended that they get tested at least once a year and every time they have a new partner. These guidelines are recommended by the CDC. What should we know about preventing STDs? All adults and adolescents from ages 13 to 64 should be tested. They should have an annual chlamydia screening for all sexually active women, annual gonorrhea screening for all sexually active women, syphilis, HIV, chlamydia, and hepatitis B as well. Screening at least once a year for syphilis, chlamydia, and gonorrhea for all sexually active gay, bisexual, and other men who have sex with men. Sexually active gay and bisexual men may benefit from more frequent HIV testing, and anyone who has unsafe sex or shares injection drugs equipment. Since our patient is our teen young adult population, it would probably be more helpful to reach out to them about this information. According to the CDC, state and local education agencies and schools can help support STD prevention by educating students about HIV and other STDs, promoting communication between parents and adolescents, providing on-site testing for HIV and STDs, teaching students how to find HIV counseling and testing services, and providing referral to testing, counseling, and treatment services. According to American Sexual Health Association, young people are more likely than any other age group to have multiple sex partners, engage in unprotected sex, use drugs and alcohol at high rates, engage in high-risk behaviors while under the influence of drugs and/or alcohol. Young people aged 15 to 24 represent only a quarter of the sexually active population, yet they have almost half of sexually transmitted infections. Teens aged 15 to 19 account for 40% of chlamydia cases, and males 20 to 24 have the highest rates of gonorrhea. According to the Advocates for Youth organization, young people of color are at disproportionate risk for STIs. They want to promote programs that seek to lessen risky sexual behaviors by encouraging condom use, delaying sexual initiation, partner education, and early HIV testing and treatment. The Office of Adolescent Health of the U.S. Department of Health and Human Services provides information on federally funded Title X family planning clinics that offer low-cost STD testing for all who want and need them. The Code of Ethics for Nurses was established in 1950 to support ethical obligations of nursing in the constant changing healthcare environment. Understanding key aspects of nursing ethics helps nurses to be competent in decision making. It helps personal and professional development. It helps practice with compassion, respect, dignity, worth, and unique attributes of all people. Advocate for the rights and safety of the health of all patients. The word ethical is used to point out reasons for the decision about how one ought to act. The rights, well-being, and safety of individual patient should be the primary factors in arriving at any professional judgment concerning the disposition of confidential information, whether it's oral, written, or electronic. The standard of nursing practice and the nurse's responsibility to provide quality care require that relevant data be shared with those members of the healthcare team who have a need to know. Only information pertinent to a patient's treatment and welfare is disclosed, and only those who directly are involved with the patient should know. An ethical dilemma often occurs when a nurse must provide care for a minor. Nurse must consider the best interests of the patient with wishes and beliefs of the parents. When difficult situations arise, a nurse must remember that her priority is the interest of the patient. Another dilemma may arise when nurses' beliefs are different from the patient's regarding reproductive health. A nurse must always be aware of her own beliefs and be careful when speaking with the patient. According to the Minors' Right to Confidential Reproductive and Sexual Health Care in New York, minors who fall into one of these categories can consent for medical treatment without involving their parents: emancipated minors, married minors, minors who have children, and mature minors. Also, all minors can consent on their own for reproductive health, including pregnancy tests, contraceptive care, and abortions, prenatal care, including labor and delivery services, medical care for themselves and their child, testing and treatment for STIs, drug and alcohol abuse care, mental health care, emergency medical care, and post-sexual assault care. According to the Department of Health website, on May 20th of 2014, Acting State Health Commissioner Dr. Howard Zucker released the first ever New York State Youth Sexual Health Plan. The plan is a guide to ensure that accurate sexual health information and quality health services are made available to all youth in New York State. Some of the goals are to reduce the rate of HIV and STD infections, to reduce the rate of unintended pregnancy, to make available HIV and STD testing and screening through school-based health centers, to promote healthy and safe relationships and decision-making, to increase knowledge of and access to contraception and other sexual health services, and to educate professionals and youth about the difference between healthy sexual relationships and abusive ones. We hope that you have learned a lot throughout this video and that you are able to apply this in your career and in your life. Thank you for watching. Have a great day.